I think medicine is very unique and the possibility is endless in terms of what you can learn on a medicine rotation, right? Because it's going to encompass like every specialty, and if it's like, for example, a lot of students want to go into a specialty practice. I want to do ICU, or I want to do transplant, or I want to do infectious disease, and you might get bummed out and saying like, oh, I didn't get that rotation. Like, for example, myself, when I was a student, I was like, I really loved it to do an oncology rotation, which I didn't get, right? But on medicine, you actually see patients with all these different conditions. They might not be admitted here specifically for that condition, but they have that history and it's still an active problem, right? So it gives you that exposure to these different disease states. So on medicine, we have everything. But sometimes it's the luck of the draw, right? And you just don't have these patients getting admitted, or they have a history of CHF, but they're not here for CHF, they're here for pneumonia, right? It doesn't mean you can't learn about CHF using that patient as an example, right? So you can look at their medications. Are they on GDMT? Is this what you learned in school? And then, by talking about those things with your preceptor, you can kind of learn about CHF, even though it's not a cardiology rotation, right? So that's why, like I said, medicine is very proactive. It can learn a lot more than just whatever the patients are here for.